So today's video is about disabilities or different abilities. I want to do a little bit of a preamble that this is one of those issues that very much has changed over the decades and centuries in terms of definitions. And Carlene's going to give us some statistics and some ways to think about this. But we've talked about other words, let's say the words around Indigenous world, where in one era people may have been called Indians, but then it became First Nations to respect them and show them as nations, sovereign nations, and then it became Indigenous because that way it's more self-declaring, and then it became Cree, Potawatomi, Gitxsan, Niska, and these are all really wholesome, good ways for any oppressed group to come to take more control of defining themselves and teaching us, whoever the not them is, so settler in this case, teaching settlers how to honor and respect Indigenous people. And when we're working with social work with victims of abuse, we always wish the people, the group, the oppressed group or marginalized group or edge walker group, that they define themselves. That's a very important thing. I'm not here to define anyone else and put any labels or words on them. So we position ourselves as listeners and absorbers, and like I'll absorb your truths, and as allies. So Carlene's going to tell us, she's been doing some research here about disabilities, and I would invite her to summarize some of what she's been finding.
I'm going to be looking at some papers, so like if I'm not looking at you, it's not because I don't care. The first thing to talk about was the fact that there was different models that define what disability is and who's considered disabled according to the government. So we originally had, prior to 2016, a medical model which focused on like physical and sensory impairments and like other documented health conditions. And that kind of excluded like cognitive and mental disabilities. So that's why the original model was considered the medical model, and the social model of disability, which is 2016 implementation and 2017 forward, moving into statistics, is inclusive in considering like cognitive and mental impairments, and it also included other like environmental factors and things that would essentially prevent or limit your function in society. Because of that, it's important to consider how you're going to compare those statistics. So prior to 2016, the estimated population of disabled people or people that considered themselves disabled didn't change. It only was increased from 0.5 million from 2012 to 2017. And this is like including ages like 15 plus. However, the amount or percentage of people of that population that is considered disabled under that model changed because of that. So when you're comparing the statistics, consider that the medical model doesn't consider mental health conditions as a disability, even though it doesn't impair your function in society and your ability to live an optimal life. It's not considered a disability to the government prior to 2016. So that being said, in 2012, the estimated population, or people that in a census said that they were considered disabled, was 27.5 million, and in 2017 it was 28 million. So of those people, the government estimated that 21.4% of the 27.5 million in 2012 were likely to have a disability. And then of that, 13.7% were actually considered disabled. In 2017, 35.3% were considered likely to have the disability, and 22.3% of them were actually considered disabled. So the increase from 13.7 to 22.3% is significant, but the increase from 27.5 to 28 million isn't as significant, only in the sense that there's a larger increase in people that are actually being documented and receiving compensation or workplace accommodation. Overall, that means that 1 in 5 or 22% of the Canadian population is going to be disabled, and that's aged 15 plus.
So about 1 in 5 people.
1 in 5
About
people.
1 in 5 people.
And the prevalence of disability increased over the lifetime, so obviously there's a lesser percentage of people age 20 or age 15 to 24 that are disabled than 25 plus. And it increased quite drastically. So for 15 to 24, that was 13% of people were disabled, and 75 plus was 47%. So 47% of the disabled population was
almost.
older. Yeah, so almost half. Women were 4% more likely to have a disability, so men were 20% likely, and women were 24%.
Okay.
The most common types of disabilities were related to mobility, flexibility, pain, and mental health.
Okay.
Youth, so 15 to 24, the most documented disabilities were mental health related. And people aged 25 to 64 were less likely to be employed than those with disabilities.
Okay.
Than those without disabilities.
Okay. So if I could connect with those things that you said, that's really profound that you summarized it that way. Thank you, Carlene. I wonder if I can get Stephen to get the way I've written that word, disabilities. I've seen it written that way, and it's an important thing for us to remember that whenever someone has a limit or a challenge, they may also have other abilities that we want to affirm, celebrate, amplify, utilize, cherish, etc. Right? So some people who've done research and scholarship and activism around disabilities have said that the reason people have a disability is because the world hasn't customized and offered them opportunities. So let's take a really basic thing of ramps. Instead of having a stairway with 3 steps, think of any public building. Many public buildings will have 3 steps. Well, if you're in a wheelchair or you're an older person with a walker, those 3 steps block you from everything. You're in a situation. You're locked out. You're exiled from whatever it is you want to utilize. So a lot of this concrete example, literally concrete example, many people have said we should make it almost illegal or undone to have stairways. Why would you ever have 3 steps when instead you could have just a slope to all public buildings, and then a person with a wheelchair or a person with a walker or a person a mom with a carriage for her child or anybody, all humans could then have the opportunity to enter that building with the cement slope instead of 3 stairs. People who aren't limited or challenged with their legs or their hips or their ankles, they can go up a ramp. Why do we ever have stairways? What do you even need them for? It's also easier, by the way, to snow shovel if you have a ramp, right? So if the world was organized different ways, there would be far few people who would ever feel exiled or disabled or limited or locked out. And one of the core values in our social work with victims of abuse is we're here to advocate for everybody. Our mission as a profession is to try and maximize everybody's opportunities through the whole life cycle. So advocating for ramps or advocating for elevators instead of 5 stairways to go up. An elevator means everybody, the person with the walker, the person with the baby in the carriage, the person in the wheelchair. There's so many ways we could build our future world differently that would be wonderfully opening for people with physical limits, and those who don't have those same challenges could just get on with their day. Nobody loses. We're creating win-win. And I'll tell you, from what I've heard, it costs no more to make a ramp than a stairway if you're doing it right from the get-go when you're designing buildings. So put that out there. Then I also want to comment on, when we've got previous videos, I want to link with what Carlene has said, is very important about who is doing the defining. Sometimes, because of patriarchy and capitalism and funding, federal, provincial, municipal governments may wish to have a very constrictive definition of who is disabled or who has a challenge, because they don't want to put them on a disability pension or to subsidize their life in any kind of way.
Even more
Yeah,
in-depth description.
exactly. So what do we even mean by that, right? And who did the defining? What we wish to do as social workers with victims of abuse is invite people to tell us, where do you have challenges or limits? Do you define yourself as disabled, and in which ways and in which moments? And does it even matter, right? Because there may be, if it was a world, or if the world is set up so that there are ramps and elevators, they're functioning at the same level everybody else. It's fine. Don't worry about it. That's not what they're here to talk about today. I want to talk about intersectionality. We did a video on that too. Intersectionality. Again, if you're the Queen of England and you're in a wheelchair, your life is going to be fine, because you're the Queen of England. You're going to have a very fancy wheelchair. You're going to have somebody who can push your wheelchair around. You're going to have a wheelchair accessible van. You're going to be fine.
Driver.
You're still going to be fine. You don't have to worry. But if you are Indigenous and you live in a very rural, isolated environment, and there are no buses, and you need to get to medical appointments, and you're poor, you're going to be in a really tough situation every day when you wake up, because you're not going to have the supports and resources like the Queen of England. So whenever we're working with the client, we need to reflect on intersectionality. How do all the parts of their lives click together? And some parts are going to, they're deal breakers, right? Other parts aren't going to matter.
She's there. She's open.
We have a cat trying to break into our house right now. And, who is it? Oh, that's Cuz. That's the one that makes fights.
Yeah.
It's the rebel. We have a rebel cat. So intersectionality, all the identity pegs. Sometimes it doesn't matter. Said differently, a client comes to you and says, I was sexually abused. My uncle comes in my bedroom. He does these bad things, etc., etc. The fact that she may have a wheelchair may or may not be her priority issue to be talking about. We invite her to explore with us what are her priorities and how that matters in the moment. We are going to be experts on patterns, and one of the patterns we know is, if you have a disability or a limit, the more disabilities and limits and challenges you have, the more someone will become predatory around you, because they know they can get away with it better. They know you may not be as believed, or you may be stigmatized, and so on. So disabled women, disabled girls are very vulnerable to being abused.
Mm-hmm.
And often the intersectionality parts of their lives, i.e. often because of physical disabilities, you can end up poor. And because you're now poor and disabled, you can end up being really vulnerable to turning to alcohol or drugs, or turning to, or depression takes over inside you, which then makes you more vulnerable to being abused, right? So that's part of why we always want to go back to that thing around intersectionality, and we also want to look at interdisciplinarity. So people who are a doctor, or who's a teacher, or who's a nurse, or a social worker, or a landlord, are all going to look at that situation differently. Mm-hmm. But the way we look at it is based on her, the person who's in front of you, and she says, my uncle abused me. Mm-hmm. This is what we want to talk about, and that's how we want to affirm her and strengthen her in whatever ways that we can. So
Before you
insert some pieces, insert some more pieces.
So, on that topic of intersectionality, there was some stats, and one of the ones that stuck out was among the disabled, aged 15 to 64, lone parents and like single people who live alone were more likely to be living in poverty among like all the types of living arrangements. However, 8 out of 10 in a different study, but used here, 8 out of 10 parents that were single were women. So that disproportionately affects women.
Yeah, exactly. So again, the intersectionality. With each unique person in front of you, you want to look at all the parts, their age, access to resources, who do they have in their life to support them, if they're, rainbow folk. There's different ways that all of that is going to intersect and have meaning. And that's part of why it's so important for us to be attentive and attuned to each of their... She's still there?
Yeah, the sound is coming. You want to close that with?
Yeah, you can probably close it. Yeah, we'll just hope that she goes away. We have an invader cat. I have 7 cats, and there's one that wants to be number 8. The first 7 aren't keen on it. That's why we're having that little conflict over there. Oh, can we stop the video? I'm sorry. I don't want